Action.
Good morning, Rebecca. How are you doing?
Good, how are you?
Good. I just wanted to see if you had a moment for me to be able to tell you a little bit about our heart failure program.
Sure.
Okay. So I know you see clinic patients, but you are also rounding at the hospital, correct?
That is correct.
Okay. So I'm sure you already know, but heart failure is actually one of the top discharge diagnoses from the hospital.
Yes.
And then typically those patients are rehospitalized within the first 1 or 2 weeks. So our goal with this is to decrease exacerbations and hopefully keep people out of the hospital, of course. So I just want to kind of show you this. So to begin, this program really focuses on patient education and compliance and self-management, because with this diagnosis, there's a lot of new things these patients have to learn. For instance, we'll go over, medication education, and we'll really talk about maybe side effects and dizziness, things like that the patient's not expecting. And we'll also teach them how to read food labels and know really what they're putting into their body to try to, get ahead of any kind of swelling or edema or anything like that. So another thing that's really cool about this program that we offer are physician-specific protocols. With this, it allows you to be able to tell us exactly how you want us to treat your patients. So if your patient wants to gain 2 to 3 pounds in a day or 5 pounds in a week, we could go ahead and give them the diuretic to where we're not calling you after hours or on the weekends. We go ahead and give it to them and monitor them to hopefully keep them out of the hospital. And then another thing, we can throw in 5 PRN visits, and to where, again, if it's a weekend or a night and you don't want to be contacted on your cell phone and you want to hang out with your family, we're able to just go out there and get them seen and hopefully, again, keep them out of the hospital. Another thing that's really cool that we have, and we give this to each patient, is going to be this zone tool. So basically they have the green zone, yellow zone, red zone. So green zone means there's no swelling, anything like that. They're doing good. It's a good day for them. Yellow zone is whenever we'll throw that protocol in, and basically they can call us instead of calling you, and they'll say, hey, I've gotten on the scale today and I gained 2 to 3 pounds. Or I'm having some tightness, I'm having some swelling, and we'll go out, we'll go ahead and give them that diuretic, and they should be feeling a lot better. Red zone means they're having extreme tightness, a lot of swelling, and typically we'll go out and either we will, we'll assess the situation, we may end up having to bring them to the ER, but at least we're able to do that, and we will of course let you know. And then lastly, with this protocol, every single visit is gonna be, they're gonna do heart and lung sounds, weights, everything like that. And then within that first 30 days, we're really gonna front load therapy visits to where there's a lot of visibility between our nurses, our therapists, things like that, to where they're being seen constantly, basically.
Oh.
So, do you have any questions or
That
anything?
sounds great. Just as soon as I have somebody come in that I know is not compliant, or especially a new heart failure patient, I will be sure to give you a call and see if we can't get them set up on this program.
Okay, one other thing. I wanted to see if maybe like one day, maybe early next week, if you'd be interested in maybe sitting down with me and I could bring you coffee and we can sit down and try to do this protocol and make sure we're treating your patients exactly how you would want to be treated, you would want them treated.
Yes, that would be great.
Oh,
yes,
perfect.
I'd love to
Okay.
do that.
All right.
Maybe next Wednesday at 2 o'clock.
Oh, perfect. Okay. Well, I will just text you and I'll figure out what your coffee order is.
Okay, that sounds good. Thank you,
All right.
Alyssa.
Thank you. Have a good day.
You too.